to really get this out there and make these talking points that we embrace. A researcher who was a colleague of Dr. Wink's from France, Yannick Marchalant, says he coined the motto, "A puff is enough," because it appears as though a single puff each day is necessary to produce significant benefits. Now, I like to go a little further than that myself, but you know, if you're not comfortable with cannabis, then it's good to know you could vaporize a small amount and have some really profound protective effects for your brain. Here's another study I like. This is talking about some of these studies, but the headline was, "Marijuana Megadose May Build Better Brains, Curb Depression and Anxiety," study suggests. And actually, this is a different one. This is from a Canadian study, and this was the researcher Zhao Zhang, and his quote was, "Chronic," I like that, "chronic use of marijuana may actually improve learning memory when the new neurons in the hippocampus can mature in 2 to 3 months." And that marijuana is the only illicit drug that seems to trigger the production of healthy new brain cells instead of suppressing it. So we need to really think about this and make these our talking points and get the word out and stop feeling like we're doing something wrong. I've always, since my entire adult life, I've been a health nut. I was a macrobiotic, trained as a macrobiotic chef and worked in that for a few years. And I never felt marijuana was harmful, and now the science shows it, that it's beneficial. We need to get to the point where we can have legal use of marijuana, get rid of prohibition, because then what we can do is, for the people who are uncomfortable with the idea of getting high, they can have subpsychoactive supplements that they can ingest and get these effects. Prohibition is robbing us, completely robbing us of this, which is our natural birthright of health. The plant was meant to be used, and it should be used. And I also want to say one thing that's really depressing. I mentioned that the government hasn't seized on this and is not working very eagerly to produce remedies that will work on Alzheimer's. And in fact, there's some funding going to people who are doing just the opposite. There was one researcher, and he did studies, and he put out his press release. The information was, marijuana doesn't help Alzheimer's disease. Well, this was right when I was writing this book, and it was kind of horrifying when I saw that headline, and I stopped, I took a breath, I said, no, something's wrong here, because there's just too much evidence in the other direction. And what I found out, he said that we hoped to prove that marijuana would help against Alzheimer's disease. What we just found, it had no effect. In reality, what he was using was a synthetic cannabinoid. He wasn't using marijuana, he wasn't using THC, and it was in rats. So it really had no real-world application. I sent him an email asking him if it wasn't unethical to promote this kind of research as proving that marijuana has no benefit for Alzheimer's, when there's so many people that could benefit from marijuana for Alzheimer's, and I never got a response. But these are a lot of the studies that are done. You'll hear studies that say marijuana causes brain damage in juveniles. There was a study that they promoted this several months ago. The study injected juvenile rats with synthetic cannabinoids. No one's running up marijuana. No one's mainlining marijuana. It has no real-world application. When you look at marijuana and the studies that are epidemiological studies, they tend to support the findings that marijuana is beneficial. So none of you should have any regrets or any concerns or any guilt at all about marijuana. You should be proud. You have less chance of getting cancer, several forms of cancer and Alzheimer's disease, according to the science, than people who aren't using marijuana. And if you have relatives and loved ones who are at risk for these diseases, you might want to suggest they start trying it.
That's terrific. I feel much smarter, and I'm going to follow your medical advice. We've got a little time for questions. We'll take the hand mic down. We have a first question here, and it's a good one.
Good
Excuse me, if
afternoon.
you would introduce yourself and say where you're from.
Yeah, my name is Clint Werner. I'm from Santa Fe, New Mexico. I've been a member of AARP for about the past half dozen years. Read their literature, which is usually very helpful when you're thinking about retiring. But in the past half dozen years, AARP's been missing in action on this. They're conspicuous by what they don't say, and I'm wondering if anybody from Normal has approached them and talked to them about the findings, particularly we just heard from the journalist author and the like, and what response was received. They're very influential. Can't hear you, sir.
Hello, are you there? I wrote to the people at AARP about, I would say now about 10 years ago. I can't remember exactly, and said that I thought that it would be important for people they do such wonderful things for to understand that there is a new view of marijuana as a medicine, and that it has every, we didn't know 10 years ago how useful it might be now, but it seemed to me that just knowing what we did, that this would be something that ought to, just as right now I think parents of autistic children just must know what this might do for their children. Might not, but it might, and it won't harm them. I felt that they ought to, and I volunteered to write a piece on marijuana for the AARP. They said, good, do it. And so I did. And I sent it off to them. They assigned it to an editor who so chopped it up and took it apart and made it look like I was a member of the Drug-Free America people. I mean, it was a long ways from what I'd written, and I wrote back and said that edit is just not acceptable, and I do not want to publish that way unless you publish it the way I wrote. It was non-negotiable, and so that ended my effort to get to those folks.
I can try to answer this question regarding AARP. 3 years ago, it's been 4 years now, they do polling like nobody else, as you can imagine. They know exactly what their members and their members soon-to-be trends and preferences are. And so they detected a strong preference for medical cannabis starting around 1998, 2000. So in 2004, 2005, when they still were publishing something for the younger part of the AARP crowd called My Generation. Some of you might have received it. It was out there for 3 or 4 years. It was canceled under new leadership there. And they hired a writer. The writer's name was Ed Dwyer. And some people's names go way back. Remember, he was a writer for High Times magazine in the 1970s. But he'd been writing for years for the best publications in the world. He just happened to have been at AARP at that point. And they were about to publish, they did publish a poll, which got a lot of headlines in 2006 or so, but under the leadership of a guy named Bill Novelli, who came out of the anti-smoking crowd, president of the League Not to Be Into Tobacco Whatsoever, he stopped any association with AARP and medical cannabis whatsoever. He's resigned, and under new leadership, this might be an issue they will come back to. I'm just giving you back to the moderator. That was the answer to the question.
And we're impinging on your time, Ellen. Do we have time for a couple more questions? Madeline?
We already had a couple of people that were lined right here.
Good afternoon, panel. My name is Miguel Valdez. I'm with MMAPA, a nonprofit that assists indigent patients, hospice patients, disabled veterans, and people who can't afford medical marijuana due to fixed incomes. With that, Valerie, thank you very much for all the work that you've done. It's inspiring, actually. With that said, we're moving our program into Arizona, a place that's very conservative, and where the fear of the devil's weed still exists. My first question is, how do you propose ways to counteract this mindset when science is something that people completely disregard? A second thing that I want to ask was, as a social smoker who is a patient advocate, I know that I can always have cannabis available to me. I can make a phone call and get what I need, et cetera, et cetera. But for patients, that access and that affordability is a problem for them. How do you see the larger cannabis movement working together with the medical cannabis movement to make sure that both of our agendas are complete? Patient access, legal access for recreational users.
Lester says tell him to join normal. Well, first of all, yeah, right. People who don't believe in science are not. What's that?
The mic.
The mic. People who don't believe in science are not going to believe in science. So, right.
Yeah, it's not.
So, but one thing that, at least what I've done is approach people who are sick. The people who are ill and their family members are really, they move mountains because it's an personal experience. And there are a lot more people who, because of fear, are cloistered. And it's really where to reach into the communities, MS communities, Parkinson's, cancer, HIV, AIDS. You know, the queer community is usually pretty strong in having stood out already and being marginalized. And so you'll find great allies in that community as well. And building in, you know, there's no subsidy for marijuana, whereas there are subsidies for other drugs. If you don't have enough money, you can write a company often and get, if your own insurance company won't allow you access to medicines. That's where legislation comes, I think, becomes very important. And we saw with Prop 19 that there were pieces missing. At least, you know, there wasn't anything in there for a subsidy for helping patients or helping marginalized people, financially marginalized as well as physically marginalized. So I think that that's a place that we could look. And, you know, nonprofits are suffering throughout the nation. So to build more nonprofits that can't make money is really not a feasible avenue. You know, to look, many in our community, many of the dispensaries still send patients who don't have money to WAM. So we, you know, we're at a tipping point. But again, there are always more people who need it. That's a suggestion. I mean, there may be others as well.
Lester wants to add
I think that one, Lester, this is falling apart.
Okay, well, I don't stand.
It's coming apart.
It's old.
I'll see if I can just move over here. You know, it can be discouraging, there's no question about it, but it's something one has to deal with. That bringing data to people about marijuana is like bringing data to some sacred text. It isn't appropriate. Marijuana is bad, and that's all there is to it. And we live in a day when I just started to read Richard Dawkins' The Greatest Show on Earth. It's about evolution. And do you know that 40% of Americans don't believe in evolution? I mean, it's just incredible. Or just as a contemporary, look at the polls about the number of people who believe, who are birthers. I mean, that goes right in the face of, it isn't science, it's just, it's simple, you know. Well, I tell you what I think the answer is. When the Marijuana the Forbidden Medicine came out, the first edition in 1973, one of the first letters or emails I got about it was, you just did it as a Roman horse, a Trojan horse, because you think this will bring about legalization. Well, cross my heart, I had no such strategy in mind. But the fact of the matter is that's what it's become virtually. I mean, for example, take my experience at the Harvard Medical School. Those of us who edited publications at the medical school met monthly with the dean who was in charge of Harvard publications. And because I had invented and was editing the Harvard Mental Health Letter, I was part of that group. And he said to me at the beginning of a meeting one day, Lester, would you stay for a minute? I'd like to talk to you about something. You know, I just skimmed through your book, Marijuana, the Forbidden Medicine, the last thing I thought Steve would ever read. And he said, I wanted to ask you a question. My mother-in-law, who is 67 years old, is suffering from pancreatic cancer. She lives in Miami, Florida. Now, you mentioned something about it, what's it called, Marinol? Marinol? I said yes, as a synthetic THC called dronabinol or Marinol. I said, sure, I'd be glad to tell you how to. The problem with his mother-in-law was she had pancreatic cancer, but there isn't much you can do about it. Your job is to make the patient as comfortable as possible. And she was suffering from chronic nausea from this thing, and it was just spoiling what life she had left. He said, would this Marinol help her? And I said, it probably would, but she'd be much better off if she smoked marijuana, which, she never smoked marijuana. Never. Imagine even mentioning that to him, that he would suggest that his mother-in-law smoked marijuana. I said, okay, and I told him, I gave him a dosing schedule, and I said to him, listen, Steve, call me, have her call me, give her my number if she has any problem. Well, about 2 weeks later, I get a call from this woman in Florida, and she reminded me who she was. She had tried Marinol for 2 weeks. It seemed to work at first, but it doesn't. She even raised the dose. And I said, do you have any grandchildren who can teach you how to use marijuana? And she said, I have a granddaughter who's been dying to get me to use marijuana. I said, okay, here's what to do. Have you ever smoked? I knew the answer. Have you ever smoked marijuana? Oh, no. Have you smoked cigarettes? No, I haven't smoked cigarettes. Okay, you've got to be careful. Now, here's what I want you to do. You get your granddaughter to teach you how to roll what's called the joint, and then she's got to be with you the first few times you use it until you're confident you can use it all by yourself. And the way I want you to use it to begin with is to take one puff and wait 2 or 3 minutes. This joint will go out, you'll have to relight it, and then just keep doing that, always with an interval of about 2 or 3 minutes. And then quit when one of two things happens. You either get anxious and uncomfortable, or you find the nausea has gone away. Well, I didn't hear from her again, and nor did I hear from Steve until the next one of these meetings at his office. And again, he asked me to stay for a minute. He said, Lester, I have to tell you, our whole family is indebted to you. And I said, how so? He said, well, let me tell you briefly the story. She developed another medical problem in Miami. They medevaced her up to the Mass General. They all had clinical offices. His clinical office was at the Mass General. She was admitted there, and it was clearly, I can't even remember what the other problem was, but it was dwarfed by the pancreatic cancer. There was no point in any other, it required surgery, but there was no point in it. She wasn't going to live very long. And so they then discharged her, but in the meantime, Steve and his wife Barbara decided she would live with them in Wabam, which is one of the communities around Boston. And she went home. Now, so Steve said to me, as I said to you, we can't tell you how indebted, and that was it. I was pleased to hear that. Didn't hear anything else, but Steve always had a Christmas party, Steve and Barbara. We're walking in the front door, and Barbara says to me, Lester, we are all so indebted to you for, and it's, now, she told me the following story, which is the point I'm trying to get at, taking a long time it seems, but she said, you know, when my children, and she had they had three boys, one of whom became a lawyer, one a physician, and one a landscape architect, all very successful. She said, when I heard they were smoking marijuana in college, I raised, holy hell, I really came down on them. And she said, when I saw them sitting around the kitchen table, rolling those cigarettes with my mother, and they're all sitting around and having a wonderful time, she said, I thought to myself, what in the world was all the fuss about? What did I... And you see, I think this is going on countless times all over the people who would never have thought about this as a medicine or even a safe drug for whatever reason are changing their mind, because it's not that you bring some data to them, you see for yourself that this is not a dangerous drug. And that is how this is going to come about, thanks to medical marijuana.
Thank you, Lester. We look forward to Lester's closing remarks tomorrow, and I'm afraid we are way over our time. I want to thank, and we can't take any more questions. I apologize. I thank our wonderful panel, and we continue with the conference. Thank you.
Hey, listen, I'm going to